Minimally invasive methods are of increasing significance in the treatment of varicose veins. Here you can see the so-called Salon method for the treatment of valvular insufficiency in the saphenous veins by means of radiofrequency power. The nature and stage of varicosis present always need to be clarified in advance in terms of diagnosis and duplex sonography. The treatment of saphenous vein insufficiency shown here was taken from the protocol as performed at the Center for Vascular Medicine and Vascular Surgery of the Media Park Clinic, directed by Dr. Chamchi and Dr. Schulte in Cologne. The intervention may be performed under general anesthesia, spinal or otherwise local anesthesia. General or spinal anesthesia is recommended for combined treatment using mini-phlebectomy and/or crossectomy. The bipolar Cellon ProCurve 1200 S15 applicator is used for the treatment of insufficiency in the saphenous veins. The Cellon Lab Precision Power Control Unit is set at 20 watts. Access to the vein at the distal insufficiency point is achieved either by ultrasound-guided percutaneous vein puncture or by a cut down onto the vein. The region recommended for treatment should not be more distal than 10 centimeters below the knee crease in order to avoid saphenous nerve injury. The applicator is inserted and passed proximally. The applicator tip should be placed using ultrasound control approximately 2 centimeters below the saphenofemoral junction. The lowermost competent epigastric vein branch is often a good position. Should the vein be located at less than 1 centimeter under the surface of the skin, a tumescent anesthesia is recommended in addition to the general or spinal anesthesia in use, with the objective of increasing the said distance. After positioning the applicator, it's recommended that the patient be brought into the Trendelenburg body position so that the vein in question is largely empty of blood and likely to collapse during the intervention process. The power required is generated by activating the foot switch. The applicator is drawn back evenly from the proximal to the distal point, in the process of which the pitch of the acoustic signal should remain as level as possible. The speed of withdrawal should be approximately 1 centimeter per second. The radiofrequency energy discharge heats up the wall of the vein, which in turn leads to denaturing of the collagen, contraction of the vein diameter, and ultimate closure of the vein. As soon as the wider shaft marking at the tip of the applicator becomes visible, the power supply must be terminated by releasing the foot switch in order to prevent burns on the surface of the skin. Following the intervention, the access point can be closed using steri-strips or sutures, depending on the size of the puncture. Subsequently, a compression bandage is positioned between distal and proximal points. A thrombosis prophylaxis with low molecular weight heparin for about 7 days is recommended where endovenous procedures are used. To achieve optimal results, compression stockings should be worn for 3 weeks. We wish you success using the Cellon method. Any further information you may require can be obtained directly from Cellon or from our internet site www.cellon.com.